Good morning. I think I perfectly accommodated to the British weather. I got a cold. Nevertheless, what I did in the last 2 years was thinking about quality management in animal-assisted interventions. And one of the big questions was, how can we try to increase quality without needing people that need to have a PhD to rate if an intervention is a good intervention or not. So what we did is we tried to develop an instrument that can be applied by nearly anyone who we could get from the street. And that's what I'm going to talk about today. Of course, I did not do that alone. My co-authors are Lisa Glank. She has a PhD in veterinary medicine. Natascha Steskal and Esra Schroffenegger, those both people are masters in clinical psychology, and the person from the Vienna School Council in relation to educational studies. I'm going to tell you something about quality management you might know, but I want to summarize at least a bit what we can do in animal-assisted interventions. I'm going to focus again on why I think this is relevant and how we can do that. As in science, in the whole, it's just one way and one idea, of course. I'm going to present you the instrument and the factors we found to be relevant for people that are not used to observation. I'm going to show you some of the results and a short discussion. So why do I think it's relevant? It's not a new thing that we have a huge hype in animal-assisted interventions. The problem that I'm seeing is, I see it especially in Austria, but I also saw it in the Netherlands now, that many people are just bringing an animal with them and call it animal-assisted intervention. Or, even worse, they call it animal-assisted therapy. That means a teacher who's bringing his or her dog to school is calling that animal-assisted intervention. And I mean, I think we all agree on that. It's definitely not. We have few regulations. We have no legal restraints, at least in Austria, only super tiny bit. We have no transparency. That means every plan, every therapy schedule, everything that people develop, they tend to keep it to themselves because they are afraid that anyone could steal it. And one of the most relevant points from my point of view is the protection of animals. If people that are not used to or educated to work with animals, but only to work with people, many mistakes might happen. For example, if I do work with a person with snake phobia, and I'm not an expert in snake handling, but I work with the snake for 3 or 5 hours, what I know that colleagues are doing. And I work with the same snake 3 to 5 hours, and I handle the snake, and I don't have an expert with me. I think, again, we all agree that's not the best thing for the snake. So the protection of animals is something that needs to be done to make sure that the animal-assisted interventions are really good. From my point of view, only the benefit for all partners leads to the best outcome that we can have. And of course, the protection of humans. I mean, that's security management. And I want to remind you of the Ohio Prague Declaration, 1998. I'm sure you all know that. But I did look at it again, and I found many things that are actually not done, at least not by most of the people. And you don't have to read the whole thing. I just put some of the most relevant parts. I'm not going through it. I just wanted to remind you of some of the relevant things, which is domestic animals. I think I don't need to say anything more like that. Positive reinforcement. In the last years, dog trainers are making a huge thing out of the fact that they are using positive reinforcement, as if that would be something new. I mean, it's good that they are doing it now, but yes, positive reinforcement. It's already in the Prague Declaration, 1998. Properly housed and cared for, safeguards for the animals. From my personal point of view, safeguards for the animals means that in exactly that situation I was speaking about, the snake phobia treatment, 3 to 5 hours, that there would be a person, an additional person that's an expert in snake handling. Because how is it possible that that therapist that's focusing on the patient is able at the same time to work with the snake without being an expert in that? But of course you can be both. But then you need to have further education in that. And I'm not 100% sure if it was meant that way in 1998, but my interpretation is that. So I'm saying it's already in there, the potential benefit for all parts. And I mean for the animals and the humans. The freedom of choice. And I love it that we already have it here. Because I'm sure you all are aware that many therapy animals don't have the freedom of choice when they are dragged along in institutions, in the worst case, placed on a table with wheels and run around in the hospital, and then from all sides, the people are coming and petting the dog. And that's then animal-assisted intervention. So from my very personal point of view, that's not freedom of choice. Everyone has to decide for him or herself, but that's how I see it. Appropriate workload, very relevant. Of course, that's different from animal to animal, as it is different from person to person. But I think it should be clear that a dog cannot work the whole morning in a school class from 8 to 1 or something like that. We need clearly defined roles, we need confidentiality, and we need training provision. Again, my interpretation, animal-assisted intervention should cost something. And I really like work that's done because of the cause. But if it should be valued, there should be at least something for doing that extremely exhausting work. Speaking about freedom of choice, we thought about that for a very long time already, and we're not sure how to figure out how to measure that. And that's just really one basic idea, and we still want to do something more, but it's already extremely interesting. We worked with 2 different groups of dogs. That means we went along in the animal-assisted interventions. What we did, we took salivary samples, measured the cortisol level before, directly after, and 1 hour after the intervention. And as you all know for sure, there is about approximately 20 minutes delay in when we can measure it in the salivary sample. So in reality, we measured before, during, and kind of after the intervention. And we had animals that had to work in a very strict setting with collar, lead, maybe on a table, had to be in a special position to be petted. And we had a second group where the dogs were without anything, no collar, no lead. They were allowed to move freely in a room and had an additional room where they could go to if they wanted to avoid the whole situation. They did not do it, but they could have done it. And the idea was that, of course, it would be great if we would see something, and actually we did. And although it might be something that we all could have thought of before, so that's clear that it's like that, I think it's still very, very relevant to show that we can actually have biological measures to show the stress level of the dogs that are brought into that closed situations. And what you see is that you have the dark blue line. Those are the dogs that have no freedom of choice. And you have the light blue line where you have the dogs that can do whatever they want. And the very interesting thing is that it seems that during the intervention, they are even more relaxed than before. The idea is that, of course, coming into an institution, having all the people around in groups of, I don't know, 5 coming along. We always also do video observations, or there is a huge thing going on. And then there is a hello, and then there might be participants and whatever. So that's the idea of why we have a higher cortisol level before. And afterwards, we go for a walk, of course. So that might be the happiness that we go for a walk afterwards. So that was only just one small excursion into freedom of choice, where we did the first study on. And what we thought regarding quality management in animal-assisted therapy, I think I already said the most. It would be education and training for humans. It would be education and training for animals. It would be evaluation, not only per therapy. So at the beginning, the person was like that, and at the end, the person is much better. That's not evaluation. It would be per session. There would be something that I want to reach during the session. And I know that that sounds more like animal-assisted therapy, but I think also for all activities, there should be at least something that we can say what we reached. I think a weekly supervision kind of psychotherapy, or a person we talk to who is an expert, we need for the humans. And from my point of view, we need at least monthly checkups for the animals. So I'm going faster to the instrument. I'm telling you what it was about. The most relevant parts in interaction are, of course, social and emotional skills. That means if we think of interaction between those 3 parts, we need to look at emotional and social competences of humans and animals. And what we found after creating a huge item pool using 20 professionals from human-dog interaction, not only psychologists, diverse professionals, that created items. We had a huge item pool. And then we had many, many people filling out that item pool. And we came up with, of course, a reduction of those items, and then doing the whole thing again, and finding 7 relevant factors. And we have interaction factors, 4. It's about trainer versus participant, trainer and dog, participant trainer and participant dog. And of course, we have sub-skills in that. And then we have the emotional part, where we have one very relevant factor regarding boredom, discomfort, initiation of contact, and so on. And what we did in that instrument, we did not say, we did not use a key term, a scientific key term. What we did is we used a description. Here it says, gives a treat to the dog. And then the person, the observer, needs to say never, seldom, whatsoever, all the time. And then what we have in addition, and that's going to be deleted for the final version, of course, is I cannot answer this question, and that did not occur. And regarding the dog, we have, for example, anxious. We have never, seldom, whatsoever. And then, and I think that was a relevant part that it's possible to do for naive people, how intensive was that emotion. And again, the two additional parts. So what we found is that non-professionals are actually able to evaluate using protocols, but what we need are very, very clear instructions. I only have a few seconds left, that's why I'm saying how we did that. If we try to compare, for example, dog owners or professionals, what we did in that study, with people who don't have a clue about dogs, and we compare that, how they feel out the instrument, we get nearly the same results. We have some significant differences, but so far they are not relevant. That means these significant differences occur in factors that were not found to be relevant for the overall assessment. So it seems that there can be a relatively cheap way of doing quality assessment by having people sitting in the intervention, using a protocol, and filling that out exactly as it's given because of the descriptive nature of the instrument. Thank you.